So today is our 2005th day of uninterrupted daily webinar series of IFPH.
Sir? Yes, you can continue.
Okay. So today is first of all I have to congratulate all the backbones of the IFPH members who have their unconditional effort to succeed all these effort to fulfill their journey to this 2005th day of uninterrupted daily webinar series. So we are welcoming all the students, physicians, and homeopathic well-wishers to this platform. Today, and also I am welcoming our none other than our Dr. Jolie Janardhanan DHMS. And before that, a silent prayer for 1 minute. Okay. So I think all are familiar with our Dr. Jolie Janardhanan because every day she is attending this daily webinar series and we are familiar her face as well as her voice. And she is 40 years of experience and she is retired as a superintendent from Thrissur Homeo Hospital. Now she is running her own clinic and today our subject is very important subject and it is this is thyroid diseases and its management, homeopathic management. And she is now giving a good explanation of the causes of hypothyroidism and Hashimoto's thyroiditis. So we can welcome our today's speaker, Dr. Jolie Janardhanan, to this platform. Ma'am, please come to this platform and you can now share this.
We are presenting a case that is Hashimoto's thyroiditis. But how we can diagnose is the topic here today. The patient only presenting their symptoms and they are describing their problems, pain, and what they are going through. That's through that agony. Otherwise, the patient cannot explain that this is a Hashimoto's thyroiditis. So we have to carefully. Doctor should carefully examine the patient and a patient hearing and the signs of the patient has to take together, then along with blood examination. Then only each and every chronic disease that a doctor can diagnose. So I am presenting today one case that is yesterday a patient came and she told me that I am coming from a hospital and they told no problem with me. Then I asked her, what are the problems you are suffering from? Then she told that I have severe headache. Okay. Then what others? Falling of hair with the hair. Then I told, is there any thyroid problem with you? No. I have no thyroid problems because that at that hospital they checked T3, T4, TSH, and the doctor told me that there is no problem at all, and there is no need of worry. All these problems you are suffering is only maybe your feelings only. But she told that I have severe pain in hands and the bones and muscles. So is it a feeling only? I told explain more. And your thyroid is normal. Okay, okay. Thyroid okay because your TSH is normal. And the doctor told nothing to worry. But the physician told. So what are the other problems? So what she is telling, whatever I am not taking much food, then only even then weight gain. I am getting fat more and more. Okay, okay. But at that time also, her thyroid is normal. That is the statement. So there is no way to suspect there is a thyroid problem. Then we have to think about some others. What are the others? What are the other problems? So then, sir, can you hear? Hello? Hello?
Yes, ma'am.
Yes, ma'am, we can hear.
We can hear you.
Okay. 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 Thank
Are
you.
you good
Thank
with
you.
the slide?
So,
Do you?
no, keep that slide there. After
Okay.
explanation only, we can.
Okay.
Because I am telling that also that symptoms and that is in the case first slide.
Sure.
Case first. I am explaining that slide only. Or that slide. So, what that major symptom? She explained that she cannot sleep during night. I cannot sleep at all. Okay, but sleepy all day. Then what is the next problem? Then pain in chest. There is pain in chest. Like a pulling pain. Okay. Pulling pain in the chest. Then the doctor told that pulling chest pain may be due to the infection or some inflammation of that muscles, because you have already explained about your pain. That is also your feeling. Okay. Then what other they are telling? She is telling. She explained palpitation while climbing steps or fast when walking fast. Okay. Then what are the symptoms? Uh, this is a chronic case because the patient is suffering, but that there was no diagnosis, and the patient not diagnosed, and told that patient she had some feeling only from the hospital. So I asked her, what about your mind? What are the problems going on? So she told that she's irritable. Okay. Had a quarrel with a neighbor before 2 years, and now also it is continuing. Now the case is in the police station. Okay. Maintaining cause. That is a maintaining cause. So, and she has financial crisis. She is crisis. She is a farmer and work in farm up to noon. After that, she got very much. She is very much tired, fatigue. Okay, that are the problems with mind and the presenting symptoms. Then I told that patient, go and take a blood check. For what? I checked that patient thyroglobulin, anti-thyroglobulin antibody, and anti-thyroperoxidase antibody. And then other checking was done that this is the lipid profile. And what are the findings? We have to think about that. There is antibody. This is case is Hashimoto's thyroiditis, because antibody of anti-TPO antibody and anti-thyroperoxidase antibody is presenting with high cholesterol. It was Her cholesterol level was really in a danger situation. This such a blood check did not done in that hospital, and it told that patient no problem, and cholesterol level is 272 and triglyceride 399, that is 400. The normal is 150. Triglyceride means it is a fat which high energy storing thyroid in the triglyceride. High energy because of excess of food, fat and carbohydrate, the high energy stored in the triglyceride. And when the triglyceride increases in the bloodstream, it may cause that it may cause occlusion of the artery and may cause a stroke or cardiac coronary artery diseases. So she is such a dangerous condition, and her triglyceride is 400 and cholesterol level is 272 and HDL cholesterol 43. That is low, and LDL is 194. So if we also neglect her and told, if I had told that patient no problem, what will happen? This will have, she is always telling that the doctor told T3, T4, TSH is normal, but here TSH is normal, but that is the point. Before checking TSH, we have to check anti-thyroglobulin antibody and anti-thyroperoxidase antibody. And that cholesterol, why such increased cholesterol? So the total cholesterol total cholesterol means what? That is responsible for formation of hormones and other body functions, tissue builders. Cholesterol is tissue builders, and triglyceride is highly danger because they are storing high energy, and it is when it circulates, it stick onto the blood vessels and causes stroke or coronary artery diseases and all other problems, as we know. So that diagnosed this case as Hashimoto's thyroiditis. Doctor, next, that blood report, can you? Okay. That's a mind. That blood report. Anti-thyroglobulin antibody 395 and 54 international unit per ml. Even this antibody of anti-thyroperoxidase antibody and anti-thyroglobulin antibody increases in such a level, and they are already manifested the signs and symptoms till then only T3, T4 and are normal. T3, T4 are normal. TSH, see, the TSH level is 2.34. It is very, very important. So we never depend upon TSH. When the problems or the TSH gets high and high or go down and down for Graves' disease, there is no need of waiting for a change in TSH, because the disease are already developed before 3 or 4 years before changes occurring in the TSH level. That is a research, and in my teaching of thyroid diseases. Then I told her that. Then, so one or a doctor asked how we manage Hashimoto's thyroiditis. Then, with this case, we can discuss how we how we analyze this case. And one more important thing. So after diagnose this case, I told her, please go and check your vitamin D. Your vitamin D may be very, very low. And why, if you had vitamin D enough, there may not such an increase in the thyroglobulin antibody and thyroperoxide antibody, because vitamin D is a hormone as well as a nutrient to the body, and it can modify or it can prevent the overaction of immune system in autoimmune disorders. So if a case, however it may be, if diagnosed as an autoimmune disorder, we should check vitamin D. It's a very, very important nutrient and hormone to modify the overaction of the autoimmune disorders. Then what? Checked that vitamin D next day, that today, then the vitamin D 15005, normal 30 is normal nanogram per ml. So vitamin D is only half, 30 is normal, 15. But calcium level is 9.98. It is somewhat normal. How to interpret this report? If vitamin D is low, the calcium absorption from the gut will decrease. There will be no proper calcium. But here, calcium is normal and vitamin D is only half. Then at that time, I asked that lady, are you any situation to expose her to sunlight? Then only she told me that she is a farmer and she is working in the farm up to noon with her husband. So that is why the calcium is normal, because she gets vitamin D from sunlight. That vitamin D cannot measure in the blood. This vitamin D is, that measuring vitamin D in the blood is the vitamin D in the liver. That it's correct. That biochemistry, its name is 25-hydroxy vitamin D. It is produced, or it is convert our food vitamin D into 25-hydroxy vitamin D in liver. Then it transport into the kidney, and the kidney is the end modification gives to the 25-hydroxy vitamin as 25 dihydroxy vitamin D. That is the absorbable form, and that vitamin D can only act in the body. But here what happened? She got sunlight direct from vitamin D from sunlight. That is why calcium absorption is going on. So that importance of vitamin D in each and every disease as hyperparathyroidism, very, very important, and all the bond, a strong bond to absorb calcium and phosphorus from the blood. Vitamin D is important. Then when come to the Hashimoto's thyroiditis, what is the other food items we have to take? One is the omega-3 fatty acid. What is the omega-3 fatty acid? It is from fish liver oil, fish oils, fish, and all fishes we can take. Some dishes are anti-inflammatory. So in Hashimoto's thyroiditis, before which repatriate the case and finding medicine, we should advise the patient for diet and regimen. Diet and regimen is 100% important, and we should give the diet chart, because this is high inflammation Anti-thyroglobulin and anti-thyropyroxidase antibodies means that it is the T3 formation synthesis stages. That stages are prevented by TPO means it is a catalyst which oxidized iodine to form T4. And anti-thyroglobulin is a large protein in which the oxidized iodine is fixing. That is biochemistry. We will discuss later. But when the antibody, these antibodies are not only prevent the functions but also give severe infection and inflammation to the thyroid gland, make it 100% damage, and the thyroid gland cannot synthesize that T3 triiodothyroxythyronin and tetraiodothyronin T4. T4 converted into T3, then only the correct active form. T3 is the active form, and not only they prevent T3 formation, this antibody, and cause severe destruction. So to prevent severe destruction, we should add anti-inflammatory foods. Anti-inflammatory foods are there for much. One of the major anti-inflammatory drug is omega-3 fatty acid. That very, very good. Then zinc and selenium. That two elements for the proper function of thyroid gland. So if it and if it is a Hashimoto's thyroiditis, it is a autoimmune disorder. There is proper intake of iodine to form T4, T3, but the stages are preventing from by our own immune system. So what the myasm is there is the syphilitic myasm. So destruct our own functions. That is, so the medicines will select in the base of the syphilitic myasm, and it is that is easy for us. We can take all the mental symptoms, physical symptoms, all we can when we take a case and that we will give end into the after repetition, we will select a medicine, but that medicine is not at all enough. The diet and regimen also has to be advised. That medicines, what type of medicines are coming in the Hashimoto's thyroiditis? Almost all are halogens: fluorine, chlorine, bromine, iodine. Then what are the other medicines? To prevent the gland inflammation. Gland, when it affects the glands, so there is not only syphilitic myasm, but also latent sora is also there. Latent sora, when combined with the syphilis, that is a scrofulous diathesis, in which each and every medicine we can see either gout or scrofulous diathesis. Either gout means psychotic myasm, and scrofulous diathesis means syphilitic and combined soric myasms. So all these myasms are responsible for chronic diseases, but we have to diagnose very early. This method, we diagnose the case very early before the patient develop cardiac problems or any stroke. If these conditions going on and all the doctors told this patient nothing to worry, there is nothing to worry, then what will happen? One day morning, she may paralyzed with the stroke because her the triglyceride is 400 unnoticed. But here what happened? Because hypothyroidism, one of the complication is hyperlipidemia, because The thyroid hormone is responsible for the combustion of all the thyroid, combustion of the cholesterol and triglyceride, and it induces metabolism, and that three, carbohydrate, protein and fat, is converting into the digestive form. So if the thyroid hormone is very low and the thyroid is not working, what will happen? The cholesterol will increase and increase and increase. So there is one more point is there. Anti-thyroglobulin antibody and anti-thyroperoxidase antibodies as first detected by Hashimoto. Hashimoto is a Japan scientist, and he first noticed these two antibodies, and he recorded that. That is why we are that name came to that disease, Hashimoto's thyroiditis. It is a hypothyroidism antibody of the thyroid gland. So what is the protocol of treatment? That select the medicines according to the patient's symptom, especially mind. Then the mind, I had already told that she had irritable, and there is quarrel with some a maintaining cause is there with some financial problems. All hypothyroidism patients, there is such a irritable factors there. Without a mental irritation, any type, that autoimmune disorders are triggered by, it is a trigger. The mental irritation is a trigger for the flaring up of almost all autoimmune disorders. So in this case, we selected medicine according to our mind, and it is tough. It's agria. It is a surface area because she has some insults from the neighbors, and the irritating and insults from police station, like all. So first treat mind. That mind treatment, the autoimmune and the disorders means the body is in a very irritating stage because of the immune system is acting against our own body. Means what? That what is the mechanism of autoimmune? Because it prevent all the vital functions through antibody. Each and every disease, the mode of action of this immune system, when in the autoimmune disorder stage, entirely different. So it is interesting to study how they prevent all the body functions. In Hashimoto's thyroiditis, it is preventing that hormones and that T3, T4 formation stages prevents. But in hyperthyroidism, what happens? It mimic like thyroid stimulating hormone, and the body, the thyroid gland is forced to produce more and more T3 and T4 without noticing hypothalamus and pituitary. So each and every disease, our autoantibody means our own antibody attacking our own body. That is the autoantibody is attacking in different manners in each and every disease. We have to discuss it one by one. So that here the case that there Naxomica is also there, because that irritability, sleep, but almost all Staphylococcus aureus covers the insult, and that ailments from that insult is very much influenced by this drug. And if it there is a arnica is also there. She had financial crisis there, and lost so many money. So arnica is that sudden loss of money. Arnica we can apply 1 dose, but the Staphylococcus here, Staphylococcus is enough. But the food, then the selection of drug is in such a way. It is according to each and every doctor. They can interpret the case and they can take the case, and we cannot insist that you should give this medicine only. No, that is we are only discussing the problems and the protocol of how to take case. Along with that, what is that food we are all going to discuss with the food. Food is very important because it should reduce inflammation. Food, vitamin D, as we already told. Then the bowel should be healthy in each and every disease. If the bowel damaged due to any problems, almost all toxins will absorb because the intestinal mucous membrane damaged. So there is it act as a sieve to and will not allow that healthy mucous membrane to bacteria enter into the bloodstream in the intestine. So a healthy gut it should be maintained with probiotics like that, and healthy bacteria should be in the bowel. And in the Hashimoto's thyroiditis, the patient should not take alcohol. Even though ladies are there, male or sometimes male patients also there. So the restricted food, that alcohol and some all fried items, everything has to avoid. But food, what food to be taken is that in each and every disease, the fresh vegetables are recommended first. In hyperparathyroidism, hypoparathyroidism, and Hashimoto's thyroiditis and Graves' disease is the hyperthyroidism of the thyroid gland. All cases, fresh vegetables are recommended, and colorful vegetables means colorful fruits, apple, blueberry, strawberry, all are colors. So that advise the patient to insist to take such fruits and vegetables, and excess of carbohydrate and fat has to be reduced. Otherwise, the triglyceride will rise because there is very low T3. So there is the metabolism is not functioning properly. We that with our medicine, and we are treating thyroid gland, and our medicine will prevent the infection and inflammation and the damage, and antibody will subside because of this medicine. Along with the mental calmness is a very important factor here also, and fish is very good. Then that all the berries and grapes are also very colorful. Grapes, have you seen the grapes, violet, and all the colored fruits, and orange, citrus fruit, all the citrus food has to be taken by the patient. Then what other? The leafy, green leafy vegetables, oily fish. Then some chicken parts, not a chicken as a whole. That is the problem. Tell the patient, reduce all in a medium optimum measure food. Otherwise, if we will not keep that food in an optimum level, what will happen? All the triglycerides and fat will accumulate in the bloodstream. So some part of chicken, not a chicken as a whole. Then avocado, we had already seen that fruit. Avocado is a very good plant-based protein. So avocado you have to advise. Then, okay, it is the diet. That is strict. When we search what are the basic problems of autoimmune disorders, it is nothing but diets first. Then mental stress first. Then environmental problems first. Then which will be second? All are first. So in environmental, that genetic factors, food and mental stress, all are first, no seconds. So we have to reduce and we have to keep the patient in a very calm mind. We have to counsel that patient along with the medicine. And the food avoid in the Hashimoto's thyroiditis what? Gluten. Gluten is from the wheat. So gluten is very, very dangerous to the Hashimoto's thyroiditis because it irritates bowel, and that irritation cause chemicals or some chemicals to release, and it may go through the blood, and the thyroid may be highly irritated by the foods. Food has most important role. Then dairy cannot given that milk over intake of milk. Then all the food items according don't take unlimited. Limit all that foods. Soya cannot be taken by the Hashimoto's thyroiditis patient. Refined sugar is very dangerous to almost all autoimmune disorders. Alcohol, very danger. Then what here told is high iodine food. Here we are mentioning seaweeds, but the iodized salt is the major problem. And as all our doctors discussed, because high iodine intake with the salt, that our common salt with iodized salt, there may be iodine toxicity. Sometimes nowadays thyroid diseases are very, very prevalent here. Even though iodine in the that hypothyroidism, we advise high iodine food has to be avoid. Seafoods avoid to prevent iodine toxicity. Because we have to take only optimum salt, and especially when it is iodized. Because in the seashore, the patients there is no scarcity of iodine, because as fishes from the sea and all that plants growing near the sea are rich in iodine. But when it goes to high ranges, there is the problem. So don't consider all the patient as a whole. Then refined oil and cruciferous vegetables has to avoid, because it has to cook, and don't eat as a raw, like a cow. Don't take all the cruciferous cabbage, cauliflower like as a raw. We are not cow and animals. So cook it, and the thiocyanate will reduce. Sir, I am concluding, because if some doctors want to ask something, is it okay? Hello?
Yes, ma'am. You already finished the screen sharing, ma'am. So any other cases to show?
No, today one case only.
One case only.
That is only 10 minutes remains if some doctors want to ask or discuss the case. That's why I am concluding.
Okay, okay, ma'am.
Only
So
one
for
case.
those who have any queries,
Doctor, one case is enough, because
yes,
we
yes.
diagnosed one case. That is the discussion here. And I discussed how Hashimoto's thyroiditis in the body affecting. If some doctors wants to ask something, we will discuss it.
any other slide, ma'am? Do you want to change the slide?
No. That slide is the food
Yes,
slide and
Okay.
that blood reports only. I described it.
So if anyone have any queries, please ask questions to Dr. Jolie. She is ready to answer our doubts.
Today only one case we are discussing because only 10 minutes is there. If we are going to discuss other case, we will get no proper time. But the one doctor asked how manage Hashimoto's thyroiditis. If that Hashimoto's thyroiditis stage is that the thyroid follicular cells can absorb iodine, but that T3 D4 synthesis stage will prevent. That is Hashimoto's thyroiditis.
So,
So,
ma'am, two participants raised their hands. So can you unmute yourself and can you please ask? Or
sometimes there may be spongia, natramure, calcareous carb, calcareous iodide, aconite and lycotonum, iodine tincture, all are not at a time, but all medicines we have to apply. Fucus, it is the seaweed, and badiaga for hyperthyroidism. It is the freshwater freshwater sponge, and the spongia very rich in iodine. Spongia, that is why spongia is coming first rank in almost all cases of thyroid, because it contains high amount of iodine, because the sponge is in the sea. Spongia. Then what is a sepia? One of the major medicine for hyperthyroidism and hypothyroidism. According when selected with medicine, it is the ink, masking ink, and sepia is also masking their mind from others. What they are inside, nobody can detect that personality, and because of the ink in the cuttlefish in the sea. Yes, doctor.
hello, ma'am, Miss Jolie, ma'am. Can I ask one question? If the patient is taking this for hypothyroidism, if the patient is taking this allopathic medicine, that is Eltrosin 100 for a long years, so 20 years, is it possible for us to complete withdraw the Eltrosin and give our homeopathic medicine, ma'am?
It is possible because there is no cure. That is why prolonged taking medicine and lifelong taking medicine. It's our aim is to cure that patient. That is why we are describing such pathology, food items, and miasmatic problem, miasmatic basement. Is our aim is to cure the patient within 6 or 1 year. The cure thyroid nodules. One doctor today asked whether TRAD 4 can convert it to the or reduce to TRAD 3. We can. But that with the case taking and supplements like abinasativa, spongia, iodine, and the miasmatic drug, then biochemics like natramure, all we can cure. That is why we are present. This case is our own. The allopathy did not diagnose that patient's case. Yesterday, we diagnosed. So this case is ours, and I am never never advise these patients to go allopathy and take thyroxine. No, I will say this case because I diagnosed this case, and no other doctor is diagnosed. She was wondering with this case, these problems with more than 6 months. Rheumatoid arthritis also like that. They cannot diagnose the first. It may first what happened to rheumatoid arthritis, some joints pain. Okay, no problem. Some fever, no problem. Just like that case may drag on to 2 to 3 years, and when only deformities occurring, we are the advice to RA factor. If it checked earlier with ACCP, anti-cyclic citrulated peptide, it will affect, it may be in the body before 6 or years, ACCP. Then only after 5 or 6 years only the RA factor will be positive. Here, like antibody appeared first, and antibody, antithyroglobulin and antithyroperoxidase had already in our in the thyroid. Then TSH is normal, undiagnosed case. So this is our case. I am never sending back this patient to allopathy. I will treat this case. It is enough. We should trust that the allopathy, what they are telling, the thing, 20 years taking food, so taking medicine. Is it a cure? It is not at all a cure. Homeopathy has such a good medicines we can treat. And that is why we are always discussing these things. This this diagnosed by a homeopathic doctor, then only we can treat this case. To each and every doctor. I am.
Ma'am, I think better to tapering the dose along with our homeopathic medicine is advisable. I think so. So
Yes. That yes, doctor. I am tapering. Taper that. Reduce the thyroxine. Thyroxine means T4. Tetrahydrothyroxine.
So ma'am,
That is T4. That is inactive.
So
that is inactive form.
Yeah. So ma'am, in one case, T3 is 89, T4 is 9.16, TSH is 0.16. So she is taking medicine for a long time for hypothyroidism, but here the TSH level is very low. But this
TSH level is very low.
That is 0.16 only. But T3 and T4 is normal. She is taking medicine for a long time. Still, she is taking this Eltrosin 100, but her antithyroglobulin antibody is 16.69. So I think this
maybe
is
normal.
This is Hashimoto's thyroiditis. I think so.
All hyperthyroidism are not autoimmune. All hyperthyroidism are not on autoimmune. And that case, antibodies are not there. Because this case, there is no antibody. Is it not?
In this case, thyroglobulin antibody is 16.69. I think normally is less than 4.
Okay. Oh, so it is above normal. Antithyroglobulin antibody.
Yeah.
Please repeat.
This TSH level is low. That means it shows it is hypothyroidism. Correct. T3, T4 level normal. TSH is very low. She is taking medicine.
In hypothyroidism, TSH level has to
be high, yes, but she is actually a hypothyroid patient, but taking medicine.
Because of that medicine, the overdose of that medicine.
Yes.
Medicine is overdose of that.
T3, T4 level is now normal. TSH is very low, but this antiglobulin antibody is 16.69. That means it is high.
Yes, doctor, there is
then this is autoimmune disorder. Okay, Hashimoto's thyroid beginning.
Yes, doctor, we can have the session in the next part, discussion on that second. Dr. Boglin want to say something, and yes, Dr. Boglin, we can say auto thanks to the session also.
Okay, let's make it very fast. I thank you, Dr. Danesh. I'm Boblin from Malaysia. I would like to thank on behalf of IFPH, Dr. Jolie, for sharing her experience as a superintendent of the government homeopathic hospital in Thrissur, India. And there's one question which is on my mind and everybody's mind, that is the management of hypothyroidism. It's not Hashimoto thyroiditis, but it's hypothyroidism where the T3 and T4 are high and the TSH is low. So how do you manage it from the homeopathic point of view?
Sir, it
Sir,
is hyperthyroidism. It is hyperthyroidism. T3,
Yeah,
D4
it's
high and TSH low, it is hyperthyroidism.
Yeah, TSH is low. T3, T5
TSH
is
is
high.
low. That is not hypothyroidism, sir. It is hyperthyroidism.
Yeah, I think so.
Because
So
T3, T4 high, because of T3, T4 high, the hypothalamus and pituitary in the feedback mechanism, they are not producing TSH. Because there
yes,
is
that's right.
high level T3, T4 there.
Yes,
That
that's what I
may
was
be.
thinking.
Yes,
So-
Dr. Boblin, we will arrange another session.
Yes, I think you should tell you should
Yes, you
So
can
that
join
is hyperthyroidism, sir, not
hyperthyroidism and
hypothyroidism.
because
in the next session.
Yes, sir.
already our
And thank
time
you.
is
And once
already over.
again, thank you very much, Dr. Jolie, for a very, very good session tonight. We'll
Yes.
look forward to hearing from you. Over to you, Dr.
Very
Danish.
much thanks, and very happy to see you. Okay.
Yes. Yes, Dr. Sheila, you can conclude the session.
Yeah, sir. Ma'am, thank you very much, ma'am. It is a great day with you, and you explained very well for the hypothyroidism. Thank you so much. And thank you everyone who participated in this webinar series. And now the time is over. So we are handing over this section to the Malayalam team. Dr. Mariama, welcome, ma'am. Thank you so much, everyone.